Town councils have stepped up efforts to combat the dengue threat amid a recent rise in infections. While they say that they are targeting potential breeding grounds, they add that residents, they have a part to play. At least 224 cases were reported in the first 5 days of this week. And that was on the back of 400 cases last week. Ariel Lim with this report.
One town council with a large dengue hotspot has upped its fight against the mozzies. It's combing areas where clusters have emerged and paying more attention to breeding grounds.
We do fumigation, but fumigation is not entirely effective. No, what is more effective is actually to reduce the population of the mosquitoes through reduction of breeding habitats. So we do both.
They also spray insecticide in dark, concealed and inaccessible places. But the battle can't be fought on just one front.
Quite a number of the breeding sites are actually within the flats of the residents. So we also want to take the opportunity to reach out to our residents, to actually keep our residents informed that I think they have to play their part, to keep stagnant water out of their homes.
He hopes residents will allow officers from the town council or the National Environment Agency into their flats if needed, to help identify and weed out potential breeding sites. The threat on the horizon is real. Dengue cases have increased since December, with weekly rates hitting 400 and above in mid-January and early this month. The total number of cases is the highest seen at this time of the year since 2016. As of 13 February, there were 106 active clusters in Singapore, with 23 high-risk areas that have more than 10 cases each. These include places in Seletar, Bukit Panjang and Ang Mo Kio. Another 83 areas are considered high-risk but have less than 10 cases. 128 others are under surveillance for 21 days after no new cases were reported. The NEA has cautioned that a less common strain of the dengue virus, known as DENGUE, is also spreading. The proportion of such cases more than tripled, from 15% in January last year to 47% this January. While those who have contracted dengue before will develop immunity, it's only effective against the exact same strain of the virus. One infectious disease expert says there's concern over a possible outbreak, since not many are immune to this strain. The DENGUE hasn't been in large circulation since 1992. He added there may also be a minority who'll face worse complications if they've had other strains of dengue before.
So as long as we can manage that numbers, we can manage the patients and prevent them from getting into complications, we should be able, to save lives and it'll be minimize the impact.
Those who've had dengue before should also get vaccinated, as the expert says it'll be highly effective against most strains, including DENGUE.